Vaginal yeast infection is caused by an overgrowth of a fungus that naturally lives in your vagina, called Candida albicans. This overgrowth triggers irritation, inflammation, itching, and painful discharge. Most women experience a yeast infection sometime during their lifetime. If this is your first time experiencing the symptoms of a yeast infection, you should visit a gynecologist to verify that you actually have a yeast infection. Yeast infections of all kinds tend to develop in areas of the body where conditions are most favorable for yeast and mold to reproduce easily. Yeast and fungus thrive in moist conditions, so damp-filled the body are usually more prone to infections and outbreaks. When yeast overgrows in the vagina, symptoms of a vaginal yeast infection can be vaginal itching, irritated skin around the opening to the vagina, slight bleeding, vaginal pain, especially during intercourse or during menstruation, pain when going to the bathroom or when urinating, sometimes a slight smell that's unusual. How to treat vaginal yeast infections. 1. Keep your skin clean and dry. Yeast can only multiply to harmful levels when the conditions are just right. The best way to stop yeast from spreading is to keep your skin clean, dry and free from scrapes or wounds. Practicing good hygiene and taking care of any open cuts properly helps prevent infections, whether in the vagina, digestive tract, mouth or elsewhere. Make sure to wash the genital area with soap every day and dry off the area well after showering, since fungi are most commonly found in moist environments. When you go to the bathroom, you can decrease the risk for spreading germs by wiping from front to back. Following sexual intercourse, make sure to wash the genital area. It's possible to spread yeast infections during sex from person to person, and even two women are much more likely to carry yeast infection. Men can develop yeast infections in the genital area too. Always practice safe sex by using condoms, and abstain from sex altogether if you or your partner have an active infection. 2. Rule out allergies. Sometimes allergies to condoms or latex, soaps or other hygiene products such as bath oils, tampons, spermicidal jelly, or douches can cause allergies and infections. Chemical products are irritating to the sensitive genital area and can negatively impact the balance of bacteria in your vagina. If you have recently started using new products and notice infections taking place, try switching up your products and use something more natural instead. Also be careful about using products that cause vaginal irritation, such as those with chemical dyes, fragrances and other harsh ingredients. Avoid these potential yeast infection causes if possible. Luckily, there are usually readily available alternatives. For example, if tampons tend to cause infections, try using pads instead and always avoid fragrance spray or deodorant tampons or feminine products. Another word about douching: not only can douching cause allergic reactions, it can also alter the natural balance of good and bacteria within a woman's vagina. This in turn can create an environment that allows Candida to flourish, resulting in a yeast infection. 3. Wear clean clothes. Make sure to wear clean underwear and choose cotton underwear or another breathable fabric. Allowing air to reach your genitals helps stop moisture and warmth from developing, which worsens yeast growth. You might also want to wear looser fitting clothes and avoid stockings, tights or bathing suits if you're prone to getting infections, since these all increase body heat and retain moisture. When you do wear a bathing suit, try not to stay in one for too many hours, especially if the suit is wet or dirty. 4. Apple cider vinegar. One popular yeast infection remedy is an apple cider vinegar bath. Vinegar has many medicinal uses, some more proven by research than others. When you add a half cup of apple cider vinegar to a lukewarm bathtub and soak for 20 minutes, the acidic component of the vinegar is supposed to eliminate any harmful microorganisms. A vinegar bath is not the same as vinegar douching, which aims to flush out all bacteria, that is good and bad bacteria, from your vagina. Doing so leaves you more prone to a recurrence of the yeast infection. 5. Boric acid. Boric acid is a powerful antiseptic that some women claim is useful for treating yeast infections that are resistant to other remedies. According to a 2009 study, topical boric acid showed encouraging results as a treatment for vaginal infections. Some health websites claim boric acid vaginal suppositories may also be effective in treating vaginal yeast infections. Boric acid is toxic in large amounts. It can lead to kidney damage, acute failure of the circulatory system, or death if you absorb enough of it. To avoid this, don't use boric acid on broken skin and don't take it orally. If you're pregnant, you should not use boric acid in any form. Always mix boric acid with water before applying it to your vagina or vulvar area. Six. Prescription tablets. Certain vaginal yeast infections may require a more aggressive treatment than a cream. Your doctor can prescribe 1 to 3 doses of the oral antifungal fluconazole, which has a success rate of up to 90%, according to the CDC. If your infection is chronic, your doctor can give you a standing prescription. Having a prescription at the ready may also be worthwhile when starting a course of antibiotics if on previous occasions the drugs prompted a yeast infection. 7. Garlic. Garlic exhibits strong antifungal activity against Candida species, making this a great and easy home remedy for yeast infection. Many will agree when we say that garlic can lend aroma and flavor to dishes like no other ingredient. Yes, in its raw form, it doesn't seem too appetizing, but it sure can spice up your meal. Apart from topical application, include plenty of garlic in your diet to fight the overgrowth of yeast. The recommended dosage is 2 to 4 cloves in a day. Caution: do not use the garlic paste on sensitive areas such as the vagina and inner thighs. 8. Coconut oil. You can use coconut oil in 2 ways. 1. Topical application. Rinse the affected area with water and dry thoroughly. If the area is sensitive, then dry it using a hair dryer. Spread a thin layer of coconut oil on the affected area. Follow that process twice or thrice in a day until the yeast infection clears. And 2. Coconut oil tampon. Take an unbleached tampon. Soak it in coconut oil for a few minutes. Insert the soaked tampon into the vagina. Leave it overnight or up to 8 hours and remove it. Rinse off the area and pat dry completely. Repeat the process daily for 4 to 5 nights. You can also include virgin coconut oil in your diet to prevent future